Hello. Hello, everyone. Welcome. I want to say good to see everyone, but I actually can't see who is here. We're just going to give everyone a minute before we begin. Oh, yay. We have the chat. So please use the chat. Let me know where you're from and where you're watching from, whose land you're on.
Nuan.
From Ottawa, Qivioq. Hi, Minnie. So in our dialect, we would say Qivioq, Qivioq. So S instead of J. From Medicine Hat. Isn't that in Alberta? I feel like that's in Alberta. I'm in Alberta too. From Yukon. Wow. So cool. From Greenland. Yeah, Nasamyo. Another one from Medicine Hat. Wow, this is great. So many. From Quebec, Calgary. Hey, Mackenzie. I hope to see you on Sunday in Calgary. St. John's, Barhead, Alberta. Lots from Alberta. That's great. Alaska. Wow, very far from here. Winnipeg. Someone said Nain. Another one from Nain. Where is Nain? Shawinigan. Oh, Nunatsiavut. Okay, cool. Welcome, everyone. I think I'll get started. Good morning, good afternoon. Before we begin, I'd like to mention that there is Inuit interpretation available at the bottom of your screen. You can click the globe icon to turn on the translation. Unfortunately, our Galaslisut interpreter was unavailable for today, so I want to say a big thank you to Elika for providing translation, Galaslisut translation, the last 6 weeks. Yesterday was election day in Greenland, so I believe she's really busy traveling today. My name is Tupanak. I am Inuk from Inuit Nunaat, also known as Greenland. And today I live on Treaty 6 and 8 territory in Alberta. And I will be helping facilitate this webinar today. I'm very honored to welcome you to the 6th webinar today? And I'd like to begin by acknowledging the Inuit lands and waters across Inuit Nunaat, as well as the many treaties and Indigenous homelands from which participants are joining from today, again, including my own on Treaty 6 and 8 territory. This webinar series is grounded in Inuit knowledge, lived experience, and community leadership. It's about visioning together from one another and identifying what a full continuum of care could look like for Inuit children and families. We've had 5 previous webinars, and today is our final webinar. And we recognize the strength, resilience, and leadership of Inuit. And with today being the final webinar series, we wanted to say a big thank you to all of the speakers over this last 6 weeks. And we thank the viewers for taking the time to be with us here today. Your presence reflects a shared commitment to supporting Inuit children and families and Inuit communities. Thank you to our speakers, our partners, and participants who are contributing to this important dialogue. including Monica and Cindy, our Inuit interpreters, Elika, our Galashisut interpreter, who is again unavailable today, and to Corinne, our digital note taker / artists, for turning the series into visuals. Throughout the webinar series, we have been trying to focus on different components of health and wellness for Inuit across Inuit Nunaat by inviting Inuit speakers and Inuit organizations from across to share their insights, promising practices, and community-led projects. So I myself have learned so much the last 6 weeks, and I've been really grateful to be part of this. And this webinar series will be recorded and shared on our social media. Week 1 of the webinar is already up on YouTube, so go check it out if you missed out. And then please feel free to use the chat. I'm happy to see that everyone's already using the chat. Please feel free throughout the webinar. If you have any questions, use the chat or the Q&A option there is in the bottom of your screen. And yeah, this one we did already. Everyone wrote where they're from, and I really enjoyed that part. The agenda today, we're doing first welcome and introductions. We're going to do some project overview, and then we're going to welcome our speaker, Qivioq from Greenland. We're going to have a break, and at the end, we'll do some Q&A, some conversations. Yeah. I wonder, Melinda, I think this is for you.
Yes, thank you, Dupangnak. So I'll take a little bit of time to just acknowledge our funders and to share a little bit about the project itself. So I'd like to start by gratefully acknowledging the generous support of our funder, Novo Nordisk Canada. Through their financial support, they have helped to make this speaker series possible. And their support helps create space for Inuit-led dialogue, knowledge sharing, and the development of culturally grounded approaches that strengthen families and communities across Inuit Nunaat. I'll share a little bit about the project itself, just to give a bit of a background. I know this might be a little bit repetitive for folks that have joined our webinar series previously. But this project and the speaker series was first coined when ICC was working on a strategic health plan. And through the work of many individuals, including the Circumpolar Inuit Health Steering Committee members, this project was envisioned. And to give a bit of background on the CIHSC, or the Circumpolar Inuit Health Steering Committee, it's led by the Inuit Circumpolar Council. And I forgot to mention that I work for the Inuit Circumpolar Council as the Health Knowledge Transfer Specialist. I'm originally from Cambridge Bay, Nunavut, or Iqaluit Nunavut, but I live and work remotely from Edmonton, Alberta. But the CIHSC comprises of 2 members from Alaska, 2 members from Canada, and 2 members from Greenland that are knowledgeable or experts in health and wellness. So currently we have 2 members from Greenland and 2 members from Alaska, and we hope to have 2 more members from Canada in the months to come. But through their work in creating our strategic health plan, it was realized that across Inuit Nunaat, no region currently benefits from a full coordinated continuum of services that support Inuit children and families at every stage of life. And too often we're working through fragmented systems that don't fully reflect Inuit ways of knowing, being, and doing. And without a shared vision of what a complete continuum of care, what it could look like, it becomes difficult to strengthen systems or to advocate for meaningful change. So the speaker series is part of a broader effort to explore what a continuum could look like, to highlight promising programs and practices, to identify key pillars and values rooted in Inuit knowledge, and to strengthen collective understanding and unity. Ultimately, this speaker series is about knowledge mobilization, highlighting successful and impactful work across Inuit Nunaat, and building clarity, alignment, unity, and momentum with the vision of building an Inuit-led continuum in the future. So with that, I will pass it back to Dupangnak to introduce our speaker for the day.
Thank you so much, Melinda. I have to remember to unmute myself. Yes, I am so happy to welcome you, today's speaker, Qivioq Løvstrøm. Qivioq Nivi Løvstrøm is the spokesperson for people with disabilities and is a former Ph.D. fellow under Nasiffik, the Center for Foreign and Security Policy at Ilisimatusarfik, the University of Greenland. She has her master's in cultural and social history from Ilisimatusarfik. She is former chair of the Human Rights Council of Greenland, HRCG, and has experience working for the HRCG and the Foreign Ministry of Greenland as a head of section in the areas Asia, climate trade, human rights, and Indigenous Peoples Rights. She's a former focal point and later co-chair of the Global Indigenous Youth Caucus, GIYC, and under the UN, and is currently their advisor. Qivioq is also on the advisory board of Arctic Circle. Qivioq has given us the okay to share her upcoming slides, so yeah. Melinda will share the link in the comments so you can all see the slides after. Welcome and thank you, Qivioq, for being with us here today. And then I will stop sharing my screen so you can share your screen.
Thank you. I will share my screen. I just have to figure out which one of them. Yeah. I will make this. Here we go. What do you see now? You see the wrong screen, I think. I will.
Yeah, so I think we see your notes, slides.
What I can say though, the slide version, you will get it with notes underneath. I will always show where the reference is from.
Oh, amazing. So when you press share screen, you should be able to click Windows instead of like an application window, and then you can choose which one.
Yeah, I think it's showing the correct one now. How is it showing for you now?
It's just loading. So, there we go. Yeah, that's perfect.
Okay.
Amazing.
Thank you all so much for this opportunity. My name is Qivioq Løvstrøm, and I am here in Sisimiut. I have dark hair, almost greenish eyes, most hazel, and when you look at me, most people assume I'm Chinese. Even Inuit assume I'm Chinese, and then afterwards they go like, "Are you an Inuk?" So that's how I look. We like to describe ourselves here in Qivioq so that people who have a vision disability will be able to envision how we look. Yes, and today I will be speaking about our experiences and our work here in Inuit Nunaat. So first I will go into what Qivioq is and who I am as a spokesperson. I'll go into the Convention on the Rights of People with Disability and how it is implemented here in Inuit Nunaat. I will talk a bit about hidden disabilities and the general systematic challenges we face here, and then also some pointers on the way forward so that we can have a better tomorrow. Qivioq is a politically independent national advocacy organization, which actually means that we are the first in the Kingdom of Denmark. We are the first spokesperson organization for people with disabilities so that they can come and contact us. We were established in May 2017, and our headquarters are here in Sisimiut. Also to ensure that not everything is stuck or centralized in Nuuk. Our purpose is to secure and promote the rights of people with disabilities and to fully implement the Convention on the Rights of People with Disabilities here in Greenland. Sometimes I will say CRPD. That is the shortened version. So basically our version of UNDRIP, which is the UN Declaration for Indigenous Peoples' Rights. We have a small secretariat with 5 colleagues. I have written 5 dash because one just gave birth to a beautiful daughter. So we are currently 4 in reality. We are to advise and guide people with disabilities and their relatives about their rights and access to appeals here in Greenland, in Inuit Nunaat. We have to advise and guide both public and private institutions on how to ensure that they are implementing the rights of people with disabilities in how they work and also how they service people or even how their buildings looks, for example. We have to ensure that legislation and practice regarding persons with disabilities is in accordance with CRPD. And we have to assess conditions here in Inuit Nunaat for persons with disabilities. And when we do that, we have to propose initiatives that strengthens the conditions for people with disabilities here in Inuit Nunaat. We have to collect and we have to disseminate information about the conditions for people with disabilities here. And we have to cooperate with disability associations and organizations here in Inuit Nunaat to promote the betterment of the living conditions for people with disabilities here. So that's quite a lot. This is directly taken from our law. And so we always have to say this because we are a spokesperson organization, but we cannot make decisions on individual cases. We cannot do a casework, but we can issue statements and also submit enhanced reports. What that means is if people have made their complaints doing the usual routes, but nothing happens. And we can see that the municipality or the organization that is in question keeps breaking not only people's rights, but also the law. That's where we can submit an enhanced report to either the government or to the municipality. If we have done it to the municipality, it has happened before, and the municipality do not do anything, doesn't do anything, we can take that case directly to our department here for people with disabilities. That's another thing we have before anywhere else in the Kingdom of Denmark, but also in the North. We're the first in the Arctic to have our own minister for people with disabilities. So we have our own ministry for people with disabilities as well, which is pretty huge. So we can take these complaints or these reports directly to them and they can start working on it or finding other solutions. And it helps because then you can be a bit more creative. So the fact that we cannot make decisions or do individual cases does not hinder us in helping people with disabilities and their family. So all of the things we do here in Qivioq are based on human rights and on Indigenous people's rights, and also on people with disabilities rights. But before we can go fully into that, we have to talk about the fundamentals. We're all human, and all human rights are something we're equally entitled to. They're inviolable, and it's something that it cannot be taken from you, and you cannot give it to someone. They're immutable rights according to the UN. So just by being human, you have these rights. But the reason we had to make a new convention is because people with disabilities did not meet these rights. They did not automatically feel like they were able to get the same opportunities as other people without disabilities. But what is a disability? It can be something that you're born with, a congenital disability, it's called sometimes. But something like that can also show up later in life. For example, people with bipolar, a lot of the signs don't show up until they're in their mid-20s, but it's something you're born with. It's a congenital disability. Same with ADHD and autism, you're born with it, and it takes a longer time to get a diagnosis. We also have sudden disabilities. We have a lot of people who have had cancer and suddenly are not able to use their body the way they used to. Or we have people who had a brain tumor or others, any other kind of accident that made them unable to use their body the same anymore. So we have sudden disabilities, and we're getting more and more of them. We have disability related to aging, but we also have people with disability aging, because we see throughout the whole world, we're all aging as a population. So we have to consider how to ensure that our elderly are able to be part of society still without being hindered. So there are many aspects to disability that people don't often think about, that we have to do something about. And that is why the Convention on the Rights of Persons with Disabilities, the CRPD, was established in 2006. That is the Danish name. So now you can feel my pain of the double colonization here, that I have to speak the other colonial language now. Yeah. But according to the CRPD, people with disabilities have to have and must have equal opportunities in life, and they have the same rights as all other people. So these are basically a stabilizer to ensure that people with disabilities get the same rights. So that's what is important here. So now that we know what human rights are, what disability rights are, we can go into, okay, then what is Inuit Nunaat's obligations? We have to adopt laws that ensure the rights are respected when it comes to CRPD. We must also abolish laws that are not in the same vein. We must abolish regulations and other everyday norms that discriminates against people with disabilities. And that is an ongoing thing. When we say Inuit Nunaat, we refer to the public authorities here. That includes municipalities, the court system, the police, and the health service. The court system is interesting because courts are actually still under Danish law because of the Danish constitution. So we are always like stuck a little bit between jurisdictions as well. We have the equality and anti-discrimination law that got into effect 1st of January 2025, that everyone should be treated equally. And here they also mention disability, but they also mention gender and sexuality, and also whether or not you're an indigenous person or not. Like, so basically, it covers everything that could be here in Inuit Nunaat. We also have the right for self-determination. We have that in several laws here in Greenland to ensure that decision-making is in the hands of the person and not in family or in others. Of course, there are exceptions to this case, but you have your right to self-determination. A big issue we see here in Greenland, in Inuit Nunaat, is that you should have access to buildings and information and transport, especially if they're public. For example, the bank, the municipality, if you want to go shopping to buy your groceries. But most of these buildings in Greenland right now are not accessible for people with disabilities. So it's something that the government and the municipalities are still working on, and we are pushing them. The same with information. A lot of information is written only in Danish and Greenlandic. There's nothing in Danish Sign Language. There is no such thing as Greenlandic or Galaslit Sign Language right now. So if you're deaf, you are not learning Galaslit. You are learning Danish Sign Language, which essentially makes it very difficult if you're going to be mouth reading or if you're going to try to participate in the world here, because you're basically speaking Danish in a world that is in Galaslit. So information and access to it is extremely important. The same with transportation everywhere. We face the same issues across Inuit Nunaat when it comes to that. We have monitoring of these things, of course. We have to have legislation, action plans, guidelines, and procedures on how this is implemented in Inuit Nunaat. So those have been made in many places. The issue is that not always does it make sense. We have the same issue in the disability area as we see in many other areas, where you copy paste from Danish legislation without really truly considering if it makes sense in Greenland, in Inuit Nunaat. But monitoring has to be done by someone. So that's what we do in Qivioq. We also have the Human Rights Council of Inuit Nunaat, IPPS. We have the Ombudsman, and we also have the Danish Institute for Human Rights. That is the national human rights institution for the whole kingdom of Denmark. So we are in contact with them as well. So now we have like the whole system. We have an idea of what it looks like in Greenland systematically. But what about the people with disability? We have, at the very least, 1,542 citizens with severe disabilities. So those are the real numbers we have from, but the municipalities and the government have no actual numbers. We have no statistics. We have no idea how many we actually have. So what we have done is we made a report together with the University of Greenland in 2020 and interviewed a lot of different people. And there we could see that it was an approximation of 15 to 18% of the population that would have a disability. And according to World Health Organization, it should be around 20% of a population of a nation state that have a disability. So that's why we put it at around 18% in Greenland have a disability. The reason why the number is so shaky is usually if people do not get the help they need and they're desperate, then the whole family moves to Denmark to be able to ensure the infrastructure and help for their family member with a disability. So we lose a lot of people with disability and their whole family structure almost to Denmark every year. So that's why the numbers are also very difficult to keep track of. But what we can say is that the prevalence of disability is consistently higher among women. And also, when it comes to major mental disabilities, we see that those are often the women as well. So women are overrepresented here. At the same time, we see that 39% of women with disability experience discrimination in Inuit Nunaat, which is 8% higher than women without a disability. For men, the difference is more stark because we can see that it's 29% of men with disabilities that feel the discrimination, while it is only the 18% for people without a disability. We did this questionnaire where we'd ask the same-ish questions to see how people would respond. And here the respondents said that it's okay to work with a person with a physical disability. And those that said that, they were all the way up to almost 70% said that, but only around 40% were okay working with someone with a mental disability. So it showcases that there is a lot of misinformation or apprehension when it comes to people with mental disabilities. So that is a big issue we see in Greenland, in Inuit Nunaat. And another thing that we see as a big issue, now I go on to the general systemic challenges that we have heard from the citizens that contact us. Case processing issues are a very big barrier for citizens. Out of all of the inquiries we have gotten in 2022, it was 20% of the people that contacted us that said that they had issues or problems with case processing, especially in municipalities. That number went up to 39% in 2023. That's a big jump, and it showcases that we need to do something about it. The municipalities need to be better at processing cases. And here is what they said when we had held our annual meeting for people with disabilities, that it's the existing management systems that need to be fixed, and that there is no continuous communication, and there's also no proper communication across authorities such as healthcare system, municipalities, and other authorities in Inuit Nunaat and in the different municipalities. So people basically get lost between the jump of these things. And also, who is going to pay for the trip? Is it the healthcare system or is it the municipality? And then the back and forth can often end in that people are not going, even though they need to go on a trip. So that is just one example. We also have a lot of citizens without suitable housing, and this often mean that they cannot be part of society. As late as yesterday, we got a report about a woman who has not left her home because she got rehoused. She has not left her home in 3 months because she can't. So we need to do something about housing for people with disabilities so that they're able to move around, that they're able to leave and come back. And also, it ensures that they are not dependent on the network of family and friends to be able to survive their everyday life. Because some of them, because they can't leave the house, they need to give their wallet to someone and ask them to go get groceries for them. And that is not always feasible. Sometimes they have to pay extra Sometimes they don't see their wallet for a while. So we need a structure or a system that helps them better. We have this lack of available solutions because we can't just copy paste from the South. And that's why it makes people more vulnerable to various forms of abuse, like you just heard about the monetary abuse. And that's why we have to be more creative about how we want to fix things. And we see many good examples as well. But these lack of accessible solutions for all and relevant interventions that could be available for everyone if they just knew about it, mean that people with disability often feel like they're stuck. And it can be they can be stuck geographically in one city, they can be stuck in their house, or that they feel like they cannot be part of society. Often people with invisible disabilities feel that even though they can physically become part of society, that they're still excluded. So there's many different layers to how we can be more inclusive in Inuit Nunaat. So the way forward for us, the very first thing I did was to focus on working in Inuit. We work in Inuit Nunaat, so we should work for Inuit in Inuit. And so I said Inuit Nunani, Inuit. So it's a little bit like no, so it gets stuck in your head. So it's something that we use a lot whenever we want to have a solution. Is it done with Galaslit? Is it made for Galaslit? Is it done in Galaslit? And we're trying to also redo a lot of the publications we have done before, where you can see that the Galaslit was maybe not translated in a way that makes sense. So we are working on it in that direction. But it has created a lot of trust, and many people have come to us. We have new cooperation with the University of Greenland, Ilisimatusarfik, and also with the SPS, which is where we get all of our pedagogues here in Inuit Nunaat. We have actually become part of their education. We're written into it in Ilisimatusarfik. And just 2 weeks ago, I was in Ilisimatusarfik to lecture at SPS. And only a few weeks before that, I was lecturing online in Ilisimatusarfik. So we're working to create an infrastructure where we teach about people with disability already at the education level, so that when you are done with your education and start to work professionally, you already have the skills to be able to take care of people with disabilities. And we have just gotten money to do a skill development project in the municipalities. And the businesses, we also have meetings with enterprises and help them make their business more inclusive for people with disabilities. But when we come, I want to go back to the municipality thing in a little bit. We have now direct and permanent and always ongoing contact with our ministry. This wasn't there before. So now Qivioq and the department that we work with in Naalakkersuisut always have a meeting. And we have ensured now that sign language interpreters is supposed to be at all news conferences from Naalakkersuisut. This year they have, it didn't happen always, but they're working on it. So that's good. We also have regular meetings with them to ensure that we're part of their hearings when it comes to new legislation. We just got a new hearing for a new law for the support system for Inuit for people with disabilities. And we have cooperation with municipalities now, where Qaqata Komonia and Kumonaqarfik Sambersok are the two municipalities that we are in the works of getting a cooperation agreement with. And we're almost done with signing the document with Qaqata Komonia, which I'm very proud of. So one of the biggest issues we see is that legislation on case processing isn't always followed. So we need legal certainty. We need more support personnel, and we need to have a more holistic, flexible, creative support solution here for our citizens. We have talked about the buildings that need to be more accessible, and housing that is accessible should be the standard. And legislation about this is slowly being built up now, and it still hasn't been something taken up in Inatsisartut or Parliament yet, but people are working on making a suggestion for it. We also need better support for employment, re-employment, and education for not only people with disabilities, but also for the caseworkers, which is where I come with the really cool thing. Our nationwide trip for the whole of Inuit Nunaat has been funded, and we're going to be leaving in a couple of weeks already to Avanada Kumonia. We're going to travel to all of the cities, and we're going to go to Kumona Qaqatelik, go to all the cities, where we will train all of the municipality workers that we can so that they know how to work. So in this way, we will also reach the people that are already out there, already in the workspace. And we will do that in collaboration with the municipalities and with SECO, the National Confederation of the Trade Unions in Inuit Nunaat. So I am very, very excited about that. We have already started on all of the training modules so that they can be sent out. And I think it will go really, really well. So that is what we are doing when it comes to people with disabilities. And so thank you for all of this attention you have given during this long presentation. I will, I have given space to give you all of this information so that it can be used for the discussion later on, where I will also add some of my own knowledge on various areas. But thank you for your attention.
Thank Thank you so much for your wonderful presentation and also for your insight and for the important work that you do back home. I appreciate you, and I hope you know that. We will take 10-minute break. So go drink some water, make some more tea, go to the bathroom, but also really think about what questions you might have for Qivioq after the break, so we can have some meaningful conversations. Put them in the chat or in the Q&A box. I don't know what it's called. Hey, everyone. So we'll meet up at, let's say, 10 minutes from now at 57. Welcome back, everyone. Hope you had a good break. So I was really inspired by Qivioq's, where she was explaining how she looks. I never think about that. And so I want to explain how I look. I have brown eyes. No, I have brown hair and one brown eye and one green eye. In Greenland, everyone always thinks I'm Danish. When I'm in Denmark, I don't know if they can see that I'm from Greenland. I don't think they always guess that I'm Danish, though. And then growing up, I was in like an after school care with a lot of kids that has disabilities. So there was one guy that was deaf, so we learned the alphabet in sign language. So we would always like spell out words so he would understand. Sorry, that's my alarm that we're back. But yeah, thank you, Qivioq, again for that presentation. There is a question from Jenna that we can maybe start with in the chat. I'll just read it out loud. I wonder, Jenna, if you're done or if you want to. I have a question. Maybe I'll start with my question first and then make sure that you're done with yours, Jenna. What would it take? So one of the things that I was interested in hearing from your presentation is I didn't know, or I never think about the sign language being in Danish and not in Galashisu. So my question is, what would it take to develop and officially recognize Greenlandic Sign Language, and who should lead that work?
We already have a organization for people that are deaf or who have hearing disabilities here in Greenland, KTK. And they have worked a lot since, I was about to say before I was born, but I was born then. But it's they have worked for many, many years in this area. So of course, I think a lot of it would be with them. It always have to be with the people that are affected that you do the work. I can read the questions here, but maybe you will want to read it aloud first, because then I think I'm ready to kind of connect what I'm saying now to the question being asked.
I can read it out loud and then everyone can hear what the question is, and then maybe you can try to, Okay, so Jenna is my friend from Edmonton. She's from Labrador originally. She says, I'm doing a quick reading on two people, Dr. Jamie McDougall and Dr. Paige McDougall, who work in the area of psychology, Canadian deafness research / rehabilitation research, and sociology, cultural anthropology. Wow, so many big words. With Indigenous peoples and deaf communities, respectively. And I understand deafness comes with language families, much like you'd see Inuit across regions in Inuit Nunaat, being in a language family. I'd be curious about whether work can/has been done in working with Inuit Sign Language in Inuit Nunaat to develop sign language there.
Yes. And what I can say is that there's a difference between what it has been researched in Canada versus what is happening in Greenland, in Inuit Nunaat. The reason why we have so many cases of deafness and hearing impairment in Greenland is not genetics. It's because of our welfare system. It's because children have chronic middle ear infections that are not being treated correctly. And then we have up to 10 to 29% of children with hearing impairment for the rest of their lives. So it's not genetics, it is social issues that we see here, and very much also a racial profile you'll have to look at, because if a child who had an infection is Danish or looks Danish, they'll get the help immediately. But if you look like an Inuit, you will not get the help immediately. That is something that we can prove on many occasions. So it is a tendency that we see that is slowly being changed now. The way that people work is also changing because there's more awareness of these structural inequalities, as especially like people like Dubang that is on social media that speak up, forces Danish people to look into the mirror and to change their way of being. So it shows, for me, it showcases there's people like me who like to work behind the scenes, get things done, get all the paperwork done, and then but we also need people out in the front who is the face that people can remember, also often attack, unfortunately, because you have to tell the truth, and the truth hurts for many of these people. And that I would like to acknowledge that. So thank you to Bangla for doing that. You and Eka Hansen and many others have done a lot of work in that area. What needs to change is that we also need to ensure that we have proper networks in Denmark to have our own doctors. And we need to have, what we see is when we do get Greenlandic doctors, they don't come back to Greenland often because their children needs a place to go, and we don't have the proper childcare facilities in Greenland. So everything is connected, and the way we think as Inuit is that everything is connected. So why not take the creative Inuit solution instead of following the same very square ways of working that we have to adopt from the South quite often? And then someone will say, well, then what's your idea? Rah, rah, rah. And one of the earliest ideas we shared when I was a youth in ICC was that, well, we have a lot of elderly people and they're getting bored. So why not have childcare facilities and elderly care facilities near each other or in the same building so that you can do something that way that is still within our value system, that is still some in the family, so to say. Uh, and it's becoming an extended family. So that is one solution we can already now throw out there. And it's something we all recognize. We have so many elders with so much creativity, and we can help them have something to do. And when it comes to creating a Galatlisut sign language, I'm pretty sure that there's already a sign language established in other parts of Inuit Nunaat. And that is something that could become a project, and we could connect the different people with the hearing disabilities or even deafness and help establish a group for them because they need help creating the infrastructure, and then they can do a lot of the work themselves once that is in place. So I think that is at least one solution because we are really good at creating international solutions as Inuit. Like before I became a spokesperson, I was doing my PhD in the Greenlandic, uh, uh, what we were able to do when it comes to foreign relations, because we're not actually technically supposed to do it, but we still did a lot of things. So I want to point out it was a Greenlandic woman who suggested that there should be a permanent forum for Indigenous Peoples' Rights. And it was with that woman's help and many other Inuit that we have the permanent forum now. It was Inuit that were part of the very first foundation of the Arctic Council. And it was also Inuit who were part of the very first drafts of UNDRIP. We have created infrastructure not only for ourselves, but for all other Indigenous peoples. So we can do it, we can keep doing it. But I think for many, uh, too often we use the old ideology of it's them versus us. Well, why do we have to help them? Well, why do we have to do that? And if we can let go of that, I think we can achieve quite a lot together.
Thank you for that, Qivioq. Yes, you have so many good points and ideas, and I hope that they come to life one day, and they will, I feel. I love the idea of having the childcare with the elderly home close together. And I grew up with my grandparents very closely, and that was the best thing that I'm so grateful for that. I hope I pronounced this correctly. Tepisa has a question. Could the reason women have higher rates connected with disabilities is because women get tested/report more than men, especially with invisible disabilities? I didn't realize how much those of us in the States take ADA, Americans with Disabilities Act, for granted.
We have a really long waiting list here in Greenland. We have waiting list specifically for children and youth, and then we have one waiting list specifically for adults. It's usually half a year to a year. The worst case I've ever heard was waiting almost 2 years to get a diagnosis for whatever they were experiencing. Usually schizophrenia, paranoia, and depression and so forth are easily diagnosed. But things like autism and ADHD, you need to be able to tell the difference between the two and so forth. So that can take a while. And we often only have a doctor for 3 months at a time in Nuuk, and then they leave again. And then we have to get a new one. They're on a rotation from Denmark, basically. So that is the realities of Greenland. And because of that, it takes forever. And it's only the last maybe 5 years that people have truly become aware of the existence of ADHD and autism. And that is why many people want to get tested, because they feel like it can help them in their everyday life. Because we have really good laws also for people who have a diagnosis. So the thing is, when it comes to the reason we have so many women who have a diagnosis, my idea is that it's connected to our high suicide numbers. The people who commit suicide the most are young men. So there's a high probability that they are the ones with a mental disability that was not diagnosed in time. Because we also see it in girls. One of the things I remember from last year was getting a call from a woman telling us that we don't have to contact her anymore because her daughter had committed suicide because she couldn't get the proper help she needed in the education system. Because right now, people with disabilities do not get extra help during exams, and so it basically, for some of them, forces them to not be able to move on in the education system. So I think part of the answer for why there's so many women is because the men, unfortunately, do not make it. They do not become men. Yeah.
Okay, thank you so much. Monica has a question. Is there anything within the current health system I have to go a bit in place that we as non-Inuk therapists can do to support deaf, hearing impaired people while a new system is being developed? I work in Nunavut, Qivioq region. Whoa, that was hard. Qivioq region, Qujannamik.
Yeah, sure. Yeah. Thank you, Monica. There's actually a lot that you're able to do. I think you might already have implemented a lot of it. That is to work on an Inuk-based value system when you when you talk to them, of course, and ensure that you also maybe include a person they trust who is able to do sign language if you're not. And I have an app on my phone that is teaching me sign language. But not only that, if I want to say something in sign language, I write it into the app in Danish and it will pop up as a video. And I'm pretty sure there's something similar both in American and Canadian sign language. So those are options to work as well to show that you do care and you want to include their language in your everyday interaction with them. So another thing that is really good to do is maybe with the first person you have a proper connection with, ask them to help you get a sign language name so that in the future you can also um, tell them who you are. Like I tell that I am Qivioq. My sign language name is Qivioq because the Løvstrøm in Danish sound like uh, a lion, a lion stream. So that's why they have like the mane of a lion included with a stream. So that's my name. And that actually makes them go, oh, she has had an interaction before and she remembers the name she was given. So they feel seen and heard, and that is such a big thing. So those are very few uh, small things I can give you that can help quite a lot in the interactions that you can have with people.
I love that. I love your sign language name. I wanted to know mine now. Okay, so there's a comments in the chat that I think you can read, but they are not questions. So I might want to ask you another question. What are the biggest barriers that municipalities face when making buildings accessible? So you said that you are pressing them to make their buildings more accessible. Is it the funding? Is it awareness? Or is it something else that you see?
It's a little bit of mix of everything. It's often at the very beginning in the blueprint, you need to ensure that all the different needs of people with disabilities are being met. We already have a new building here in Sisimiut, just across the road, that is only wheelchair friendly for a normal wheelchair. But the issue is that most wheelchairs users use a motorized wheelchair nowadays. And those are a little bit bigger and broader, and they cannot get into the the elevator correctly. Like they need precision to get in because the elevator is too small. So, and the same with almost all places in North Greenland, most of the municipality buildings themselves don't have a ramp for people on a wheelchair to come up through. And uh, we have nowhere in the whole of Greenland where we use sound to indicate where you are or where you should go. So people who have a sight disability or are blind are almost unable to move around without a guide. So there's a lot of issues that you need to consider when you make these things, and they can get more expensive, but we are extremely lucky because we've been a little bit loud the last year since I started. A little bit loud. So the municipalities actually reach out to us now. We have had several municipalities reach out to us. We're about to have this building made. Can you look at it? Or can you help us with find the resources to do this? So this has already happened twice, and we have had two different businesses, national businesses, contact us. How can we make our buildings and our business more accessible? So it is already working slowly but surely. We're getting there.
That makes me really happy to hear. Okay, I have another question. How can allies better support and advocate alongside people with disabilities? How can we, yeah.
A really good thing could eventually also be to to join a disability organization, what they are often filled with members that have that disability or family members who, and then they sometimes need another person who will be able to help with the administration or writing the notes. And I think that's a very, very good way to be a helper, because then it's also based on what they need and what they want, and it's not arbitrary, or it's not just a repost of something. So that is one of the best ways that you can contribute.
Okay, thank you so much. Melinda, I think, has a comment or question.
Yeah, well, it's Jenna Broomfield's comment, but also like I have a little bit to add on to this. In one of Jenna's comments, she's talking about inner ear infections, middle ear infections, and then how Inuit and Indigenous kids in Canada are offered an extra pneumococcal vaccine, which for the rest of the Canadian population, I think it's just one pneumococcal vaccine from what I recall working as a nurse. And it's really like this dynamic is really interesting. And Jenna and I have actually had a conversation about this because we have children around the same age. And when we talked about it, we really couldn't find a reason why that extra vaccine is offered. And the justification that that vaccine is offered is because Inuit children have shorter shorter canals, so the bacteria and stuff can reach the eardrum easier and then penetrate it easier. And I really like that Jenna had noted that this was like racism, medical racism, and it's very accurate. I wanted to connect it to your comment, Qivioq, about how you mentioned that not a lot of Inuit doctors are going back home to work due to other issues like lack of access to childcare. Me as a nurse, I left bedside nursing a couple of years ago, and I don't plan on going back, I don't think, because there was just so many barriers for me working as an Inuk nurse and trying to reach where I wanted to. And so I think those are two really significant issues within our communities that maybe don't get a lot of attention paid to because like our healthcare systems are overworked in general, and like it's just so frustrating to navigate those systems. And then the other layer to it is that when you're offered vaccines and you're offered informed consent, really is it informed consent when you don't have the knowledge behind that? And like even for me as a registered nurse and who is educated in um, medical dynamics, it still didn't fully understand the reasoning for some of the vaccines that were being given and why certain things were being done in the medical setting. So I can imagine that there's even more barriers for the rest of the population that doesn't have that medical background. And then even further to that, people with disabilities, and especially like those with um, and correct me if I'm saying it wrong, but like mental disabilities or anything like that. Like there's even more barriers to proper informed consent. And then we don't have the structures in place to have like proper advocacy and proper information sharing and ensuring that like people are like giving informed consent. So I just, yeah, like Jenna's comment highlighted so many layers of issues for not only the general population, but significant barriers for those with disabilities.
Yeah. I can already say here immediately that even if you just Google deafness Greenland children. Like that's it. That it's not because we have a different anatomy. It is simply because treatment channels are limited and specialists are not there. So that's one of the first things. Even Google knows that it's not because we have magically different anatomy than the white people. It's not the issue here. The issue here is because the doctors and specialists are not here in the north often enough or long term enough to be able to treat all of the people that they need to treat, whether they're children or adults. So that is the main issue here. And we see another thing that could make it a lot easier for all people, also people with disabilities. If you change the way that you give wages and salaries. Right now, all of the jobs that are traditionally female, assigned to what you consider female, get a lot less in wages. So, and those are the ones that are caretakers. They're the ones that are supposed to be like the foundation of our society, and we don't appreciate them enough to give them the money that ensures that they stay. Uh, my father was his education was as a pedagogue, so that he could have worked for children, but he preferred to work in theater and in music, which are not very like stable, but that was better than working as a pedagogue. That shows you how little people actually appreciate the people who are there for us. All of us have had a caretaker when we were children. Like, so I think that is something that we need to confront in Inuit Nunaat across all of the different nation states, because we can be, just like with all the other things we have done, we can be the foremothers. We can be the ones that starts a new change globally to ensure that women and anyone get fair wages. I think that is very important because that is how we can ensure that the caretakers, the doctors, the nurses all return home. That is how we can ensure that we are all being taken care of because that's what we need. And we can't rely on AR or a robot. At that point, we need each other because the robot will probably freeze. We we do really need to be very, very uh, ahead of the curve here.
Yes, thank you so much for that. Jenna has another question, and I'll go to Linda's question. So first, Jenna is, are there programs for Inuit who are deaf to have resources themselves? And are there other resources for their families to learn, or does it simply create a silo for people who are getting access?
Yes, there was one here in Sissimut, and it was closed down a few years ago. And that is something that we still think is inexcusable because it is very much needed in Galactic Nunaat, because the excuse or the reasoning used was that there was not enough people to go to the school. But if you include all of the caretakers and all of the different educators that you have in schools and preschools, kindergartens, and everywhere that could get the benefits of learning this, we would have all of the people, the numbers needed to keep that school open. But that was not taken into consideration. That is something we're lobbying for now to ensure that we can have it, because it is more sustainable, of course, that we have our own school here in Galactic Nunaat than to have people sent all the way down to Denmark.
Thank you. Linda has a question. Are schools in Greenland good at making accommodations for children with disabilities? In Canada, we have Individual Education Plan, IEP, which describes the supports and services needed for the child to succeed.
Yeah, we do actually have we have different institutions. We have a special school, Edulungenskolen. We have legislation for it as well. Unfortunately, it's not. It needs to be more precise. It needs to cover more, and it needs to be more easily understood by both caseworkers and teachers. So that law is actually being sent out now for a hearing, for an update, for a new version of that law. So we're actually looking through it these days here in Qivioq to ensure that the children's needs are met in school, and that we need to ensure that the school teachers actually know about their rights and their needs and how to cover it. So that is one thing that we are also working towards, because right now we have managed to lobby ourselves into being part of the studieordning.
Studieordning.
Uh,
Study reform, I will think.
yeah. I will figure it out. But yeah, we're part of the school curriculum, the curriculum of the university and the curriculum of the School of Pedagogy. We are part of the curriculum now. We're written into it. Uh, and we are working on being able to be part of the curriculum of the uh, um, Ilisimatusarfik, which is the teacher education system we have here in Greenland. So, but that they uh, they haven't changed theirs in a while. So we need to work more closely with them to be able to reach that. But we have several ways that we include children with disabilities in school.
Thank you. I think, Jenna, did you want to get unmuted, or do I give the floor to Melinda? I can also do both.
Yeah, I think like if anyone would like to speak out loud, if your thoughts or your comments or questions are or if you want to go a little bit more in depth, we really encourage people to raise their hands and voice their questions or comments or anything. I see Monica has raised her hand, so I'm gonna give you access to audio and then you'll be able to unmute. Oh, Monica Palakowski. There you go. You should have access now, so you can unmute at any point, I think. Oh, there you go.
Hello.
Hi.
Hi.
Okay, I'll pass the floor over to you. I'm going to mute mine now.
Nami Kuyanak. I haven't heard that previously. Thank you, Qivioq, for your presentation. I found it. I love these speaker series because it gives me different perspectives. I'm an occupational therapist working in Inuit Nunaat. Um, and what I was in listening to everything, I did maybe a bit of a more specific question. I reflected on a patient of mine who I guess I appreciate sort of the advice that you provided me on how to connect with patients who speak in sign or are deaf, and to be supported by their families. I was wondering a barrier that I do encounter is usually with patients that are from very small communities. So there are, like, of course, the systems are not, in the South, are definitely not designed for, you know, what I see in the North. And I find that for, I think of one of my clients, she's deaf and mute. Um, and she's from a smaller community. And or maybe my question is that in small communities, even though the community is so important in supporting the patients that I encounter, sometimes now maybe there's also a fear of uh, support from the wrong people. I don't know how to phrase this, but I've had with certain families where I can see that, like, let's say, promoting opportunities for children that hearing impairments or like are deaf, in like communicating, like sort of practicing that communication, um, like, sort of like day programs or something. Either start telling me they don't trust other families, or um, or like in the day programs, for example, you referred to it, sort of like that turnover rate is really high. I don't know if I have a specific question, or it's always on my mind that in those cases, um, I sort of feel at a loss because I work in Nunavut, or I work in Hawaii, and then travel to communities once or twice a year per community. So that's not a lot of opportunity to support families. I'm sort of wondering if a family's mentioning those things, um, what are there ways that I can better, that maybe you can see me better being able to support them, or um, yeah, provide them with more information, maybe. Like, I don't want to hound everyone with like, look at these 10 handouts, but what would what is like a respectful way to sort of explore that with families, maybe? Am I making sense?
Yes,
Ian.
there's a very good question, and also a very good opportunity for me to experience just a little bit how it is to have a hearing impairment, because I had a difficult time hearing what you said. That's why my face sometimes went like this. But what we sometimes use here is pictograms, and that we use pictograms that are locally uh, grounded, so that they look like they're from the Arctic, or that they look Inuit. So instead of using uh, a little icon, you can have an icon that looks like it has a hood, or another thing that looks culturally significant for the area you're in. Um, and for us, we also uh, see a lot of case workers who have basically designed a new pictogram book with the person that they work with, so that things that that person says often can like be found quickly and be pointed to, so that that way of communicating when you are deaf mute can become a lot easier. Of course, you can also use apps, use your phone. That is something that we encounter a lot and see a lot of. We have, when we also want to give them extra things, where it's not only the people who are caretakers that have access or give access. We have, together with the Naalakkersuisoq, our minister, had discussions about cooperation with DUSES, which is the internet provider all across Inuit Nunaat, to make some kind of service available for people with disabilities, because they are the ones who disproportionately need the internet to be able to access apps or websites that help them every day. And the internet is extremely expensive in the Arctic. So that is another area where you can make life easier. We have seen others being creative where they have basically gone to the municipality and said, well, according to the law, my needs need to be met and I need to use the internet. So could you give me a stipend and pay for my internet? And some of them have been able to get some help that way, from what I understand, but not all. It's very unusual. But it showcases that across the Arctic, we all need to somehow work with our internet providers to ensure better circumstances for people with disabilities, and eventually also perhaps all of the community members as well. And another thing that can really help is your own rhetoric. If you're in a place and you maybe need someone, you may need an interpreter. This is where it's you who needs an interpreter. This is where you ask, do I need an interpreter? You never ask the person, do you need an interpreter? So that way you put them in the power position, or at least you put it in a way where you're both equal. And I think that is very important. It is a new way that doctors in Inuit Nunaat has started to speak to their to the people that they meet, and you can see a clear improvement in how the citizens feel about their experiences. So that is a really simple but good way to kind of equalize the situation.
And that was very helpful. And I actually, while you were speaking, Qivioq, I was thinking about reaching out to even the NMDS, an organization for Nunavumi with disabilities. So maybe to see if there's room for them to also help us advocate to municipalities, because there's like in occupational therapy, there's one or two of us for the whole region, and we just can't, we we have ambitions to support, but then it's like disjointed applications, right? So to have something more integrated. So, kaya namit, and sorry for being quiet.
Thank you so much, Monica, for asking that question, and Qivioq for answering in such a eloquent and um, put together way. I think that that's such an important thing to raise in healthcare and access to healthcare. You hit it spot on when you said instead of asking like, do you need this? Really, what do I need to provide the best healthcare possible is the question that should be asked. And I think when I worked as I'm speaking from personal experience here, but when I worked as a community health nurse and worked as a registered nurse in acute care floors, that's what it was. Even me as an Inuk woman, you have to create that rapport and create those relationships in Inuit communities in order to get through that mistrust and to eliminate those power differences, because those power differences are there due to past colonialism and current colonialism. And when you're in a position of power, which we are in healthcare positions, you need to find ways to innovatively understand the dynamics of the population that you're serving. And I think that there's so many barriers to that. And maybe it's a portion of it is misunderstanding what you can really do within your role. But when you're working in a healthcare position, there's no one saying that you can't go and sit down and have a cup of tea with your patient. Obviously, there's schedule requirements and you have to get through things in a certain time. But when you're working with long-term patients over the span of months and months, have a cup of tea and understand their dynamics a little bit more so that you can find ways to innovatively meet them where they're at instead of asking them in this whole new world to say okay, you come to me And then I think a part of it too is like not really understanding how to meet you halfway. Like there has to be a lot of explaining and understanding the dynamics, especially for traveling outside of their home community or traveling or even going into a new building. It can be as small as saying like we're in this building and this is the floor you're going to take and yeah, and then I think like one of the best resources that I've used as a nurse is all of the Inuit staff that you work with, like some of the clerks and the interpreters were my best. Like I couldn't provide proper healthcare without them because they know the ins and outs of the hospital. They know the patients. They're from the community. So really like finding your community of people that will allow you to provide the best healthcare is such an important aspect of healthcare in the Arctic. And I'm sure it's very similar in Greenland and even in Alaska, where you really have to utilize those community members. So thank you both for highlighting such a significant issue that we can like realistically work through.
Thank you, Melinda, for that comment. I also was almost crying when Qivioq said, like, that's such a small, significant, powerful thing you can do. Do I need an interpreter? And that's not just also for people with disabilities. It's just also, for example, my grandparents only spoke Greenlandic, and they could speak Danish too, but in the old, like they couldn't hear very well. So I feel like they only spoke Greenlandic at the end and had a tough time understanding Danish. So when they're in the hospitals, yeah, I would always be there with them to interpret. But how powerful is it that the doctor would say, do I need an interpreter? Not them. And I think that's really nice. There's a question in a Q&A from an anonymous attendee, and he says, they say, "Hi Qivioq, do you use pictograms to help explain how to take medications for medications that are given out in health centers across Inuit Nunaat?"
Yeah, I can't say for across Inuit Nunaat, but I can say something about what I have experienced here in Sissimut, Ilulissat, and in Nuuk. So those are three major cities. So you can hear I'm a city girl. Uh, we have pictograms there for children. Many of those pictograms are directly taken from Denmark. That's what I have experienced. So yes, we do need to work on our own, where they are based on Inuit. But there is pictograms from what I can see. Yay, city girls. Yeah, but I actually wanted also to come in on the significance of our language, that we use it and how it can be misused as well. Because what we know about ourselves, our bodies, and what our needs are have evolved throughout history. And when people started to talk about mental disabilities during colonization, in Gaddafi, people started to call it Tangnikut in Nakhlutsakangno or Tangnikut Napatsakangno, to have a disability in your soul or to have an illness in your soul. And so, of course, you don't want to talk about Pakumenakpok. It's embarrassing and almost disgusting to talk about a dirty soul. You don't want to have a dirty soul that is sick or ill. And because of that, we have thought it very important that we do not call it Tangnikut in Nakhlutsakangno, that we should call it Akasaktatimikut in Nakhlutsakangno. Because it's where you think, it's the brain, it's connected, it's something physical you have. It's not your pure soul. Tangnik minguit tuanak tusavok. Your tangnik should always be able to be clean. We all have clean souls. So for us, we are starting to correct politicians, people, and everyone we meet and tell them it's not your soul, it's and we have a problem here because psychiatrists and people who work, therapists, they're all called something along the line of experts in the way that the Dangnak moves. Dangnak bisusan ilisimasel. And that is not correct then. So we need to find a new word to call them, a whole profession, a whole way of teaching, a whole way of being needs to be renamed to something proper. And that might also be good because right now they're basically just given a description. They don't have a proper actual name for their profession. So that is something we have contacted, no, that we will contact the language secretariat about because by law they're supposed to create new words. So um, uh, I think this will greatly help in the discussions here in Inuit Nunaat. The public debate is slowly turning more positive because people know more about this, but also because they start to realize it's not uh, an illness in the soul. It's something completely different. And I hope that this will help, that we'll be able to create a shift. As you saw, the numbers are horrific. The way that people would rather work with someone with a physical disability rather than a mental disability. So that is why, for me, during my tenure here as a spokesperson, it's I want to ensure that we use our language and we use it correctly, and that we get a whole new way of speaking about it, about disability in Inuit Nunaat. And I hope that it will spill over to the rest of Inuit Nunaat.
Yeah, that is beautiful. I wonder, we are at the end of this webinar, and so I don't think we're going to take in more questions, but I think Melinda would like to say a few last words before we end.
Yeah, thank you, Dubangnak, and thank you so much, Qivioq. That was such a beautiful presentation, and it cued so much important dialogue that we're all experiencing across Inuit Nunaat and even outside of in our urban cities. I think that like this is a spark to reignite at a later date, and very appreciative, Qivioq, that you took time out of your busy schedule to come and join us today and share a little bit more about the work that you're doing within disability advocacy in Inuit Nunaat. I think it's so important, and I look forward to one day seeing where you're at from where you're at right now. So yeah, like congratulations on all the work that you've done. And yeah, it's not going unnoticed. And I think that yeah, very excited to see where the rest of your work heads. And as for the audience, I wanted to say that Qivioq's information is within the webinar information here. So please feel free to read her bio and to look at the website for what's it called? Blanking. Qivioq, for Qivioq, yeah, Qivioq. So Qivioq's website is on there, and if you wish to get in touch with Qivioq, please feel free to reach out, and I can connect you with her. Or I think there is some information on the website as well. I would love if some of the audience could fill out the speaker series feedback form. These tools, although they kind of seem like unnecessary, it is a good tool for us to use to continue to advocate for creating these dialogues and continuing webinars like this. So if you fill it out, I would appreciate that so much. And because this is the final webinar of this particular project, I really wanted to say thank you to the audience for joining us over the last 6 weeks. I've seen some names that have returned and that have asked really good questions. And so without your contributions to this webinar, this wouldn't have been possible. So thank you for taking the time every week to join us and to hear the amazing, very important work that's happening across Inuit Nunaat, and that is Inuit-led. I really want to highlight that because there are so many Inuit leaders that are doing such amazing work, and platforms like this really highlight and showcase the success of it. Like the work that Qivioq is doing with Qivioq and as the National Disability Spokesperson. So yeah, so very thankful and grateful for a successful speaker series and all of the previous speakers. I do want to give an extra shout out to our interpreters. Um, without your services, we wouldn't have been able to make this accessible to unilingual speakers. So thank you to Aleka, to Cindy, to Rhoda, to Monica, to Dennis for providing Inuktitut and Galatlisut interpretation. I want to say thank you to Corrine for providing some digital art and note taking. I'm very excited to see those images. And I'll share a little bit about that as well. I hope to share the report of this entire webinar series over the next few weeks to month, and that should all be available on ICC's website. If you didn't get the chance to view the prior week's webinars, all of them have been recorded and will be available on our website at some point. Our communications advisor was off for a little bit, so we're working to upload the rest of the webinar speaker series. So please feel free to go on our YouTube page and watch the previous webinars. And I also want to give a big thank you to Dupangnak for providing your facilitation skills. And that has been so essential to me being able to be in the background and listening in and hearing all of the themes and pillars and values that have come up. So thank you, Dupangnak, for joining us throughout this last 6 weeks. And lastly, I want to give a big thanks to our ICC team who have sort of been in the background with me as well, just making sure that all the technology pieces have been put together. Yeah, please feel free to reach out to me with any comments or questions or feedback on the speaker series. And yeah, lastly, a big thank you to Qivioq for wrapping up our webinar series with such an important dialogue. Yeah, it's been wonderful, and I'm really grateful to have had you today.
Thank you very much.
Yeah.
And
Okay,
I
I
hope I
think
didn't speak too fast for the interpreters. I didn't realize until later.
no, I think that they are good at letting us know if we're speaking too quickly. I got a comment in the beginning of the speaker series to slow down and breathe, and so I've been trying to do that. And yeah, it's been a learning curve for me with interpretation. Very grateful for their voices, but no, I think today was great, and yeah, yeah. So
Yes, and again, thank you so much for this opportunity. I hope any of you will reach out and that we can work together to improve.
yes, absolutely. I think that this is not the last time that we'll connect, and I hope that some of the audience will reach out to you to connect the dots too, because the things that we're facing in our specific countries is really similar to what Inuit are facing in other countries too. So there's parallels and connections to be made and lessons to be learned, and yeah, so good a good platform for unity for sure. Okay, thank you everyone, and take care, and thank you Qivioq and Dupangnak, and
Thank
yeah,
you. Bye.
bye everyone, take care.
Qivioq ingerlissingilitin.
Okay, I'll end the webinar now and I'll reach out to both of you at some point. Thank you again.
Oh,
Oh,
I'll call on Messenger, huh?
okay.
Okay, bye.
yeah.
Okay.
Thanks.
Bye.
Bye.